young. And you've done all of this. Yeah? You look very young and you've done all of this. I'm not going to ask you for your age. Don't worry. Don't worry at all. So today is World Medical Physics Day, right?
International Day of Medical Physics.
Okay. I'm looking for where to start. What branch of medicine is medical physics? Let's start from there.
Okay, so a medical physics is has to do with the application of physics in medicine. That's what medical physics basically is.
Okay.
It's application of physics principles in medicine. So we are most likely involved in the safe application of radiation. In the healthcare system. So in terms of treatment, imaging, we are at the forefront of that to make sure that treatments are delivered safely and accurately because it involves radiation. That's where we come in.
Okay, so I actually didn't know that you could do that in medicine. So of what relevance is medical physics to healthcare in Nigeria?
Okay, so I would speak from, there are different areas where a medical physicist is involved in the healthcare setting.
Okay.
So for myself, I'm more involved in radiotherapy.
Okay.
That's the treatment with radiation. There are other areas like nuclear medicine. There is diagnostic radiology.
Okay.
That's the imaging aspect where they do imaging for diagnostics purposes. And there is also radiation protection.
Okay.
As much as we are all about patient care, we're also about safeguarding exposure to even staff and the public around where radiation is being used. So for myself in our clinic at Medserve LUTH Cancer Centre, we do a lot regarding patient care, creating treatment plans for these cancer patients. We also
Go on.
We do a lot with patient care. That's in terms of creating personalized treatment plans for these cancer patients. We're involved in like a multidisciplinary team that involves the radiation oncologists. That's the consultants that actually sit down with this cancer patients to diagnose and draw up like a treatment plan. And we also have the medical physicist, which we're going to interpret that prescribed treatment in a way that our treatment machines would be able to understand and deliver this treatment accurately. We have the radiation therapists. Those are the ones that actually are involved in delivering this treatment, bringing the patient into the treatment room, setting them up, positioning them in a way that what the physicist had created as a treatment plan is replicated accurately, because a shift in maybe positioning can cause adverse effects in the sense that what was planned for that patient won't be what is being delivered. Then we also have the oncology nurses in the team. So it's like a teamwork with the aim of achieving accurate treatment, successful patient outcome. Then we also work on the treatment machines itself. We do what we call quality assurance, and there are international guidelines that we follow because we want to make sure that these treatment machines are emitting the right amount of radiation per time. We want to make sure that these treatment machines are delivering what has been planned for the patient, such that it is not underdosing the patient and it is not overdosing the patient, which now bridges the gaps between cure and complication. So we do all of that. We also involve in research. We improve on our practices. We collaborate with other people from all over the world just to give the best to our patients.
So talking about research and medical physics in Nigeria, how would you assess the level of compliance, the level of presence of medical physicists in Nigeria?
We're getting better.
Okay.
Like the IDMP, that's International Day of Medical Physics theme for this year.
Yes.
It has to do with talking about the next decade and emerging technologies.
Okay.
So from, let's say, 10 years ago, we are not where we had 10 years ago in terms of the machines we now have in centers. Though they are not enough, but we are not where we were 10 years ago. Even though I was not in the practice 10 years ago, but I have an idea of what it was like. Because even when I joined in, it was not still good enough. So there's a lot to be done in terms of the presence of medical physics. There's the presence of medical physics, and there's also the part where we actually have these medical physicists, but they don't have centers to like work in because we don't have enough treatment machines for the masses and the populate. And where we had now is that we are at the point where we really, really desire that the medical physics bill is being passed.
Okay.
That's where the government would come in the sense that we are regulated, not like medical physics is being put under a general cadre, especially people that are in government. They're not a standalone cadre because of this bill not being passed. So these are things that have to be put in place so that we can encourage the next generation of these are things, this is where we used to be, this is where we are now, and this is where we hope to go.
All right. Yeah. So today is the official celebration of the International Day for Medical Physicists.
Yeah.
What is the theme for today's celebration?
So it is medical physics and emerging technologies.
Okay.
So that's shaping the next decade. It's talking about shaping the next decade. It's talking about advancements that are coming in and how medical physics are in the forefront of implementing these new technologies in the clinic. We have new technologies like artificial intelligence.
Yes.
Yeah, we have 3D printing in such a way that you can create personalized molds for these cancer patients in a way that the treatment is personalized. We have MRI guided therapy coming up that gives like real-time image of the patient during treatment. We have adaptive radiotherapy in the sense that we are brought up to speed with changing anatomy of the patient in a way that we can see what the anatomy of the patient looks like on daily basis and make these changes as well. So medical physics, because we have this technical ability. So once these technologies are being introduced into clinics, like AI, for instance, we have at our clinic, we have what we call artificial intelligence auto contouring.
Okay.
It was introduced to the physics team, and we then go ahead to see how it is implemented into the clinic by offering trainings to the other team members that would actually use these two. So there are a lot of things that are coming up in the next decade, and we as medical physicists are at the forefront in making sure that they are implemented properly into the healthcare system.
So basically for medical physicists here in Nigeria, you're marking this day by creating that awareness to make people understand, because I'm hearing a medical physicist for the first time.
We work a lot backstage
behind the scene. And the fact that it has a lot to do with cancer care, something that has become quite prevalent in Nigeria right now, where you see a child, also going through this, and you're wondering what exactly is going on. And then sometimes you try to find out, can't this how can you try to find out how parents can test earlier. What are the symptoms, what are the things they should look at before? Because you find many parents don't even know the first or the last thing about what to look out for, or if something is wrong with the child, how do you get the child to go to the hospital, get the proper and correct, diagnosis or testing to know, okay, this is exactly what is wrong with the child. So there is still a lot of, what I call it, misdiagnosis going on.
Yes.
Yeah. Now, for you as a medical physicist and marking this day with a theme for the celebration, how are you marking this day to make sure that that information goes or gets out there as quickly as possible?
So we have, like, what we are doing currently now is a way of sensitizing the public, getting them to know about the field and the impacts we actually make in healthcare, because there are a lot of people, even physics graduates, they don't know about this particular area of physics that they can actually dive into. And another thing, in the clinic, we have a lot of patients reporting late. Aside from being misdiagnosed, they actually report late. They don't take into cognizance these changes in their body. We have people that they're just scared of the truth. They're scared of it likely being cancer. So they tend to manage it. And also finances as well, because cancer treatment is not cheap. So the thought of what it will do to their finances and all of that. And some people are not just ready for that journey because they have maybe an uncle or an auntie that went through like similar experiences, and they're trying to like compare themselves with, not knowing that probably those people, if they had reported earlier, there could have been like a better chances at, people in the cancer space. We're not magicians. So most people, because of
we expect some magic.
Because of reports that they've heard over time, they are scared. And it's also unfortunate you mentioned pediatrics, like young children and all of that. We see a lot in the clinic, and it also shows that some parents are actually taking observing these changes and like reporting them, but a lot can still be done in terms of sensitizing the public. And even currently we're doing we have like our annual conference going on in Enugu at the moment, and as an association, there's monthly webinars that we do where people come to share their experience in like various clinics across the country, even outside the country too. And we also have like Amatan schools that we run for maybe undergraduates that are looking into like coming into the field, just to make them aware of the possibilities in medical physics. It's still your side mirror on Lagos Traffic Radio 96.1 FM. We have been speaking with Inioluwa Ariyo. Ariyo, and we're exploring the relevance of medical physics on Nigeria's healthcare system. Quickly, we have a flash update. There's a procession going on at GRA Oba Kinjobi by the Nigerian Army and the police officers' wives, and this has affected vehicular movement within that corridor. And we have a backlog at Oba Kran Avenue at the moment, but we also have traffic managers on ground. Third Mainland Bridge, traffic has subsided on Third Mainland Bridge, and officers are also on ground monitoring at the Apapa Jegunle axis. Will still have good movement. Diversion point at RRS checkpoint, it still looks okay. It still looks okay, while we have flatbed trucks occupying a lane from RS checkpoint down to Area B at Papa. And Marine Beach, we have Marine Beach bus stop in Wadijara and Igomo is still good and appreciable movement within boundary roundabout. From Point Road through Marine Bridge to Igomu is still okay for now. You have absolutely no record of impediment. Okay, so we've talked about medical physics and the fact that you have some graduates of physics coming to
make inquiries or you're telling them about medical physicists, how did you get into medical physics?
Okay, so a lot of people that are doing like first degree in physics, let me say 70% of them didn't pick physics in their JAM form.
Okay.
They just found themselves there because possibly the course, their first choice, they were not offered. Then they said, oh, okay, will you do physics?
So was that what happened to you?
Yeah, that's what happened to me.
All right.
And a lot of my classmates back in school then. And there's this myth of, oh, you're doing physics, you probably end up as a teacher or in the academic session and all of that. And I didn't want that. Not that it's bad, but I didn't want that. So I just kept at it. And I remember in my third year, because for every third year student, you have to do like a 6-month industrial training outside the uni where you go and work at some place.
Yes.
So I was on the lookout for places I could actually learn something with the 6 months. Thankfully, my school then, they printed on the notice board the fourth year students that had just come back from that kind of training.
Yes.
So they printed out like a list of, okay, this is where this person did his or her high tea. So there was a list that I went through, and going through that list, I saw a hospital. I was like, what is the relevance of physics in healthcare? You know, so I went on to make a research, sent in my application, got into the hospital, got to work with medical physicists. So that's just how not like somebody told me, like we have now a lot of places where you get to hear about medical physics. I didn't hear anything about medical physics until I saw that list, and my curiosity led me into the field. That's been good so far.
That is a good one. All right, 08099120777. You can put a call through if you want to ask our guest any question. We've been talking or discussing, exploring the relevance of medical physics on Nigeria's healthcare system, and basically she's talked about, the Cancer Centre and the fact that medical physicists hold a very important position, and of course, although they work at the background, they also have a lot of relevance when it comes to cancer care.
Yes.
Now, for a lot of times when you handle the machines, you have to input programs for the machine to know not to overdose or underdose a cancer patient. This has to do a lot with computing, if I'm correct.
Yes.
All right. So this also forms a part of what you do as a medical physicist.
Yes.
Now, do you have periods when you are already a bit established, so to speak? Yes. So do you have times when you have to teach, lecture, or tutor new entrants into the profession?
Okay, thank you for the question. So I'll start with how I ended up here in terms of certifications. So after my first degree in physics or applied physics, as you have it in university, I went on to get a postgraduate degree in medical physics. Which was now streamlined to medical physics. After which I looked out to get an industrial training in the clinic. Where I worked with people that were in the clinic as well. So currently now, what we do with the machine is called quality assurance. And we follow guidelines, we follow protocols like I mentioned earlier. There are tests we do daily.
All right.
For every morning before the machine is being used on a patient, we call it machine performance check. Which we do on the machine to be able to certify that this machine is fit for use for that day. Which we want to know that it is within a particular tolerance for use daily. There are checks we do on weekly basis. There are checks we do on monthly basis. There are checks we do biannually, annually. And in terms of training, we have over the year, we have IT students from universities coming to work with us. We train them. We have fresh graduates, MSc graduates, coming to do their internships with us as well, where they get the hands-on experience, because what we have in schools is just the theoretical aspect, which is which is different from hands-on. So we have them coming 3 months, 6 months at most to get this hands-on experience, where we incorporate them into our clinic, into day-to-day activities, treatment planning, research, quality assurance on the machines, and all of that. So we do trainings a lot at the center.
So for you as a medical physicist, have you talked about research?
Yeah.
I was at an event sometime last week where they were talking about research into cancer care, research into chromosomes, cells, and all of that, and also of making sure that medically drugs or medicine that are manufactured now are specifically tailored for the African man or for the black man, as against what was obtainable before. Now, as a medical physicist, have you had cause or reason to launch a research on anything maybe concerning in the area of cancer or cancer care, or collaborated with other scientists?
As a medical physicist, what we've done so far is trying to compare the different treatment techniques that we have, because now we have advanced treatment techniques that we use. So we try to compare it to what was used before. We try to compare our results so that we know, because we have different cancers. We have breast cancer, we have prostate cancer. There are treatment techniques that have proven to give better results for breast cancer, give better results for prostate cancers. So we do this research with clinics, in our clinic, and also compare results with people outside, people in the country. But as regards launching something, as a center, Medserve, LUTH Cancer Centre, we do clinical trials. So we have clinical trials that we run, people coming to partner with us, that we run with the Nigerian patients, so to speak. So that's what I can say in that regard. So we engage in clinical trials, but as medical physicists, we have research that we do across all cancers. I'm talking about the radiation dose, talking about how we're able to limit dose to LD organs, because breast cancer, for instance, now when a patient is getting treated for breast cancer, we're treating the breast that is affected, but we are also, as medical physicists, trying our possible best to limit the radiation that gets to surrounding organs. So we call them organs at risk. So if you're treating a breast now, the organs at risk will be the heart, will be the lungs, will be the liver, the thyroid. They're going to get radiation during treatment
in small doses.
They have tolerances, which we work with. Those are things that we put into place before sending out a treatment plan to the machine for delivery. We want to make sure that we are giving as much radiation as was prescribed by the radiation oncologist to the tumor, and we are limiting radiation dose to the LD organs, to the surrounding organs. So that's what we do. So we do a lot of research around that. We talk about treatment techniques that have proven to reduce these doses more to the surrounding organs and all of that.
I want to take you up on something you said just a few seconds ago. You talked about clinical tests. So I know we see a lot of that, outside the shores of the country. People come in for clinical tests, clinical trials, and you have pharmaceuticals. Probably they want to try out a new drug or a new medicine to see if it will work for so and so person. Can you, maybe using your medical facility, can you tell us maybe off the top of your head, a percentage? What's the percentage of people that submit themselves to those, clinical tests?
I don't have a figure now, but there's a clinical trial that we're currently doing. It's been on for a while on prostate cancer. I think there are how will I put it? There are pecs involved to get this patient, maybe reduce costs for treatment, and you also explain to them in details. They sign a consent, to before they start these clinical trials, and they are not for every patient. Prostate cancer now, you can be talking about patients in early stage, just to work on. Is not a clinical trial would be, we narrow it down to particular set of patients. So the consent to it, is not my job as a medical physicist. The consent to it, they have a conversation with their radiation oncologist where they have the full scope of what is going to be involved. And I think as a center, there are maybe reduced cost of treatment for this particular patient.
Okay, so as we mark this day, your message to Nigerians, especially those in the healthcare sector, what's the message as we mark the International Day for Medical Physics Day? Yes. What's the message to Nigerians? One, creating an awareness that there's a profession called medical physicist, and this is what we mark on this day. And you talked about the bill. You're pushing for the recognition of medical physicists. So 3 things you'll speak on.
Yes. So my message, to wrap it all up, is that behind every radiation treatment, there's a medical physicist at the background, making sure that these treatments are accurately delivered, safely delivered, and because we do a lot of things behind the scene, and also for the bill to plead with the government to help us look into it, because this would encourage the people currently practicing and the next generation we are trying to get into the system, and also to build more centers with functioning treatment machines, so that when we bring in people into the field, we have a lot of graduates that are not practicing yet, because we have limited cancer centers across the country. So we are not where we used to be 5 or 10 years ago. It's getting better, but much can still be done. And for undergraduates looking into what next after this physics degree, if you're technical, passionate about healthcare, patient care, medical physics is a good field to dive into. You can do your research. You can research about Nigerian Association of Medical Physicists. There's a whole lot of resources you can play around with. All right, thank you so much, Inioluwa, for being in the studio. It's been a pleasure discussing with you, and I've gained more insight into what medical physics is about and the work you do. So I'll just say thank you for the work you do. Thank you for having me.
All right, then. So if you've been listening, we have been speaking with Inioluwa Ariyo. She is a medical physicist with Medserve LUTH Cancer Centre, and we have been exploring the relevance of medical physics on Nigeria's healthcare system. And that's our package today on Your Side Mirror on Lagos Traffic Radio 96.1 FM. Temidaya Anthony has produced. Big thanks goes to Victor Oteri, and not forgetting our executive producer Tayo Akonle. My name is Dele Agadumo. Your Side Mirror continues next week, Monday. Thank you.